10 milligrams minimum.
Greatest thing ever, right? Closest to the steroid you could possibly get without having any side effects.
Ben stopped taking it because his wife thought he was doing drugs. She didn't like the look of it.
You were getting big?
No, I think she just like saw I like put like a little into a plastic bag because I was going on vacation, and she literally thought it was cocaine.
Were you snorting
I wish. Now I'm thinking about it. Josh, I think I need to go back on creatine.
You do.
That will make me want to work out.
You
do. When I was on creatine, I do, right?
You have to go back on it.
What dosage?
Two Jews, both big and tall, no subject too small for the good guys. A Mother's Dream premium podcast team, make it your weekly routine. It's a Good Guys. And if you don't give us 5 stars, what are you nuts? What are you nuts? Yeah, we're the good guys, we're not the great guys. We're just the good guys. Whoa.
Mazel, morons, welcome back to the Good Guys podcast. We are so honored. We are here with royalty.
We are.
This guy has brought me and my wife so much joy, and not because he did my facelift. It's because we love him, we love Botched, we love everything. Dr. Terry Dubrow.
Thanks for having me, you guys.
Thank
it's
you
really
for
good to
being
see
here.
you again. Yeah, you look great, by the way. I did a really great job, obviously.
Beautiful. Oh, we are going to get there. Let's start off here because Ben, and I know you've been in person with Dr. Dubrow before.
Yes.
This man,
He's a specimen. He's a
I'm
specimen.
comfortable talking about my age, if that's what you're asking me.
Yes.
Yeah, I'm 66.
Unreal.
Yeah, and
Fit as a fiddle.
yeah, I'm very fit. Last night I try to do something significant physically every single day.
Like what?
Like, so when this is over, because today I'm doing press for Plastic Surgery Rewind, my new show that's on tonight, premiere episode 10 p.m. on E. Yeah.
Paige, you know what we're
Amazing.
doing.
I'm in.
So
I'm in.
Yeah, it's called Botch Presents Plastic Surgery Rewind, where a group of celebrities move into a house together who have had plastic surgery, and they decide whether or not to rewind it, which is not easy, but they go through this whole therapy process, and we try to figure out whether they're ready for it, and they figure out whether they're ready for it, and if they go down this time tunnel and they come out the other side, and we'll see what they look like.
Wow.
And it's interesting because life sort of intersects you at very interesting stages in your life. Aubrey O'Day, if you know who that is.
Sure, pop star.
Yeah, pop star P. Diddy. So P. Diddy got arrested her first day on the show, and it would just blew her mind because she has, obviously she was sort of abused and had that whole history. And that was a big part of her story that unfolds on the show. And then, Kim Zolciak and Brielle Berman, mother-daughter on the show, and they have a lot of issues that have been in the media recently. So there's just a lot of, besides just sort of plastic surgery topics, there's this whole plastic surgery regret, what it means to you, what happens if you do rewind the surgeries, if you do reverse the surgeries, which are high risk anyway, and just the whole gamut of sort of all the issues regarding that.
Wow.
Who comes up with the ideas for these shows, Terry?
So
are you being pitched? Like a man of your stature at this point is probably being pitched. Are you pitching them? This is a great idea, and it's very.
Yeah, this I didn't pitch. Cool. I do have a show that I am pitching called Sudden Beauty Island, where these people who are going to have plastic surgery move onto an island.
Wow.
And they're all charismatic, and then they get together, and then they are taken off, and then they have their surgery, and they're turned into these incredible looking people, and that introduces this strange attractive variable that they may have not have had before, and see how the sort of social experiment of attractiveness affects relationships.
That is genius.
Yeah, that's
it's like the better version of Love is Blind. I never understood Love is Blind. You're sitting there, you're watching these people, they're talking, they're falling in love. When if they're not attracted to each other, it's kaput. It's gone. It's you, at least you see them. It's fascinating.
It's true. It's like, well, they're all super charismatic because they overcame their physical sort of shortcomings. So they come in with this amazing personality, and they hook up based on sort of things you'd want them to get together for.
Right.
Great, emotional attractiveness and so on. And then we introduce extreme beauty into it, because some people, one thing the Swan taught me, it's you.
It's me.
One thing that Swan taught me, by the second season, we both figured out, because there were two surgeons, me and another guy, who, with just some minor things, wins the beauty lottery. Because, for example, if you took Angelina Jolie or Tom Cruise and you stuck their ears out, gave them a big bump on the nose, right? And sort of straighten out their bodies, or they were heavy or something. And then you just did those, take the bump away, pin their ears back, do little sort of things we do every day. In them, they would be they would be them.
Right.
They would be them. Extraordinarily gorgeous people. So every once in a while, some patient will come to your office who's going to have a sort of routine procedure. You go, oh, they have no idea.
Really?
They have no idea they are about to become suddenly beautiful. And careful what you wish, because, you know, you win the lottery, you think your life's going to be wonderful. But then when you look at the history of people who won lottery, they usually, there's a problem.
Yeah.
Yeah.
On the Swan, when a few of them, more than the second season, because we learned how to pick for that variable, how to make them look suddenly beautiful, it messed their lives up. You know, they immediately left their abusive husband, boyfriend. They wouldn't take BS from their boss anymore because they're like gorgeous now. So it'll be interesting to see if that show goes, what that sort of does to their relationships.
And maybe with the challenges, the prizes are like, and you just won Juvederm. You know, like you can compete for something, you know, PDO threads. I don't know.
Something like that. Yeah.
We've been wanting to ask about, Olivia and I want to ask these threads.
Yes.
That people, is that what it's called? PDO threading?
Yeah. There's different types, but that's common.
What is this? What is this?
So
tell me.
It's based on this technology that has been tried for years. Okay. Originally, these sort of synthetic threads came in this formulation where it had these little hooks on them. So you feed them in there, and then barbs. Exactly right. And you pull, and the barbs attach.
How do you know that, Josh?
I hate myself.
He's very sophisticated. And then so you'd sort of do, you know, this tightening thing from the inside. The problem is they don't work. They don't work. Now, the new kind variety works for about 6 weeks, and then they don't work. So I'm not saying that because I compete with dermatologists and non-plastic surgeons. I don't really compete with anybody. I do my thing, you know. But
sure.
I'm not saying that to try to take any business away from people who do threads. They don't work. And that is, I mean, if they worked, I'm going to tell you they work. They ultimately don't work. Don't do it.
Over time, because there's probably an instant kind of, and then just quickly it resettles, is what you're saying?
Exactly. I mean, you know, some of those, like I had a CO2 laser done on my face about a year ago. Not that deep because I didn't have the recovery time, but it took off all this pigmentation and tightened my skin and all these wrinkles. And I went in the sun. I'm sleep deprived chronically because I can't sleep very well and I work like a maniac. It's all back.
Right.
Okay. And that isn't to say CO2 doesn't work, because it does work. But threads do not work. Don't do them.
What do you think about with all these kind of the CO2 lasers and the True Sculpt and the fillers and the Botox, all these things, especially for face, right?
Yeah.
If you had someone who you knew over 5 to 10 years was going to probably spend anywhere from 10 to 20 grand on all these maintenance procedures, would you look at them and say, spend not what you would charge, but a middle of the line facelift. Spend 50 now.
Facelift at a strip mall.
Yeah, a Groupon facelift. Like, get the facelift now. Don't penny ante it for the next 10 years, and you won't actually get the result you want.
So the true answer, like everything else in life, it depends, right? It depends on the individual. I mean, if you're 40, you're starting to sort of show a little jowling and deflation of the face, you could do a facelift then, but you can sort of get this very similar result by just doing sort of this non-invasive stuff you're talking about. Really judicious, well-placed fillers, Botox, some of these non-invasive things, and you probably should wait, okay? I do agree with the early facelift. What I always say to patients is, do you know that you're going to get a facelift one day? And if they come and they go, oh, for sure, I'm going to get a facelift. And I say, okay. And then I go like this. The next maneuver is, I go like this. And I go, do you like the way that looks? And I go, yeah. I go, all right, ready? And then I let go. And they go, do that again? And I go, and they go, I go, yeah, you're not ready. If this makes a big difference and you know you're going to do it anyway, for sure, and then you understand the risks of it and you hear all the nerve damage and scarring and all those things that can happen, you might want to do it early. might want to do it. But I will tell you, one of the things I like, I don't know if you guys are aware that sort of celebrities very, very recently, like within the last few days, have now come out and talked about their plastic surgery, like Kylie Jenner, Khloe Kardashian,
right?
Ricky Lake. I mean, it's like a thing right now to be transparent. Although, how transparent are they? They're willing to admit to a couple of things, but what about the 19 other things? But anyway,
they're hiding. No, that's what I was going to ask. That
the person that comes out and gives you the laundry list left the other laundry list in the other room.
Exactly.
1,000%.
This is the stuff they're comfortable with telling you. Yes. Okay, but anyway, that's okay. But so this transparency that they are sort of talking about right now has reignited or very much ignited people's enthusiasm to go into the plastic surgeon's office and get things done. So for example, when Kylie Jenner and her, 140 million Instagram followers, maybe it's 220 now. I don't know what it is.
I think it's like 450.
Is it really?
Something absurd. Yes. And I love where you're going. I want to talk about this. The amount of international followers she has and the crazy places that these people probably went for 450cc or whatever it is, boob jobs
so you do know,
by the ocean. She's ruining these people, but continue.
So it's interesting because 2 years ago, she on their show said, "Oh, I had my breasts done before I had kids. Worst thing I ever did. I regret it." She said, "I was way too young. I love my breasts. And now I have this." And by the way, there's a picture of her yesterday. I don't know if you saw that, where they're showing sort of some scars and stuff that's in the media right now. I don't know. I think Kylie Jenner is gorgeous and I love a lot of the things she does. But to put out this enthusiasm right now without the sort of other side of it, which is, hey, I did this. You guys may like it, but, I regret it. So she's sending all these sort of 19, 20, 21-year-old, 22-year-olds into the plastic surgeon's office to have their breast done because Kylie Jenner did. She did the same thing with injections to the lip, right? Long time ago, all these people were going into plastic surgeon's office to have early injections. She does that, which is fine to create enthusiasm and transparency, but at the same time, she should remind people, hey, but I regretted it.
Sure.
And the problem in plastic surgery is the patients may start to be transparent about it, but I don't think the plastic surgeons are. We have these really expensive my new office is in Beverly Hills. I moved up to Beverly Hills. I'm on Roxbury, okay?
Oh, this is nice real estate, this is Plastic Surgeon Row.
Right?
Okay? Yeah. You walk down there, you look like you're in witness protection. You become a new person.
But it's, Roxbury, Santa Monica, Crustaceans right there. Craig's is down there. I mean, this is the place to get your plastic surgery potentially. So you come into my office and you see someone besides me, for example, they have this overhead, they have these expenses, they have, coordinators and employees they're paying a lot, they have overhead. They're maybe seeing you not necessarily, as much as I'd like to say all doctors are do no harm, the Hippocratic Oath, they're going to try to sell you surgery for sure. Totally. Even if there are cheap alternatives, even if you actually knew that, you know what? If I do this breast lift on you because your breasts have drooped a tiny bit, you're going to have scars for the rest of if you told it like that to some of these patients, they go, well, wow, I'm glad you said it like that. Forget it. I don't want to do this, or I'll do it. But, we sugarcoat things. We see everybody who comes in our office as a pre-op, as a potential sale. Okay.
Yeah.
If plastic surgeons were more transparent about what you're really signing up for, there would be much better informed plastic surgery and a lot less of it. And for Kylie Jenner to say, it's not her fault. I am not putting her down. Okay. I know she had a wonderful family. They're really nice people. I know a lot of people know them very well. But for her to send literally hundreds of thousands of 19, 20, 21-year-olds to have their breasts done, I don't know that's the right thing to do, particularly when 2 years ago she said it was one of the big regrets in her life.
And she got to spend as much money as she wanted and go to the best person, or one of the best, obviously not the best, but one of the best, to then regret it. Like, imagine how many people are nickel and diming their way to this surgery. Like, it's definitely, it's crazy. And I haven't thought of that. And if you think about food, we go into restaurants. I won't go to a restaurant with a C rating. What are you, nuts?
Right.
I'll only go where it's an A rating.
Right.
Like, where is that? Like, you're going to walk in because some friend said, oh, I got my lips done there. And, oh, I trust this doctor. It's all word of mouth. But is there any like governing body for this plastic surgeon is a crook?
No.
Like, does that exist?
And will you talk about cosmetic surgeons and
you know
these
about that.
weekend workshops? Oh, I'm on the right side.
Yeah,
of
you know
TikTok.
about it. Well, okay, two things to that. One, okay, you're right. Anybody can call themselves a cosmetic surgeon in this country. You can be a radiologist on Friday and a cosmetic surgeon on Monday.
Wow.
It's
could
legal.
you be a podiatrist?
You can be a podiatrist, do cosmetic. You can be
That I'm not cool with.
You can be a dentist. Yeah, we have this thing on one of the seasons of Botch. She comes and goes, yeah, a dentist did my nose job. And it was like, whoa,
my
okay,
God.
come on.
Respect.
Yeah, so it's legal, all right, to do that.
This episode of the Good Guys podcast is brought to you by our friends at Applebee's. Folks, the 2 for $25 deal is here. We're talking beautiful entrees. We're talking gorgeous apps, 2 entrees, 1 appetizer for $25. You've never heard of a deal this good. It simply doesn't exist. And at the quality of food, are you kidding me? We have the new chicken parm fettuccine. We got the big bangin' burger. Big bangin', okay? You can get that. You can also get spinach artichoke dip. You can get mac and cheese. There's a million items. All you got to do is go into your local Applebee's or you can order Applebee's and have it delivered right to your door like me. Maybe you're throwing on a quick movie and you think to yourself, it would go really, really great right now with this movie. Some chicken parm fettuccine and maybe a big bangin' burger and maybe a little spinach artichoke dip. That would make this movie significantly better, right? So folks, go. Order Applebee's, go into Applebee's. Honestly, if you want the full experience, you got to go to the Bees. There's nothing quite like the Bees. Get a gorgeous fountain soda. I'm sure they have free refills. If they don't send me a bill. Okay, don't send me a bill. But 2 for $25 is going on right now at Applebee's. You've never heard of a deal this good. It simply doesn't exist. And at the quality of food, are you kidding me? We have the new chicken parm fettuccine and their new big bangin' burger are featured. You can get that. You can also get spinach artichoke dip. You can get mac and cheese. There's a million items. $25, 2 entrees and an appetizer. How easy is that? This episode of the Good Guys podcast is brought to you by our friends at Function. We choose Function because it's the only health platform that gives you access to the kind of data most people never see and the insights to actually take action. Inside Function, you can test over 160 biomarkers, from heart and hormones to toxins, inflammation, and stress. You can also access multi-region MRI and CT scans, all tracked in one secure place over time. It's a near 360 view to see what's happening in your body. That's why top health leaders like Dr. Mark Hyman, Dr. Andrew Huberman, Dr. Jeremy London, Dr. Soffer, just kidding, are all behind Function Health. I'm telling you, folks, Hyman, Huberman, and London, that's the trifecta. And folks, lab visits are fast and convenient at 2,000 plus locations across the U.S., incredibly accessible. And for only $499 a year, or $1.37 per day, you're getting cutting-edge health insights. Let me tell you a little bit more, okay? All results are tracked over time in one secure place so you see how your health evolves. Insights come from top doctors based on your unique results. Could cost over $10,000 if you did it on your own, but Function's allowing you to access this at a fraction of the cost. And there's no perverse incentives. Function doesn't push supplements or pharmaceuticals. It's just powerful, unbiased health data designed to help you own your health. So folks, if this sounds interesting to you, it's interesting to me at the Ben Soffer Longevity Institute. Learn more and join us by using our link. The first 1,000 of you get a $100 credit towards your membership. Visit www.functionhealth.com/goodguys or use gift code GOODGUYS at sign up to own your health. That's functionhealth.com/goodguys.
I will tell you, the truth is, if you go to an A-rated restaurant in Los Angeles, the chances that you're going to get sick is very, 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 very low.
Yes.
If you go to one of the best plastic surgeons in Beverly Hills and you have breast implants put in, there's a 30% chance that you're going to have such significant scarring that you're going to need revisional surgery within a few years.
Interesting.
Even if he does it or she does it
Got it.
perfectly. This is like surgery. This is not, ordering Thai food down the street, on Bedford or something.
Yeah,
This is
yeah.
like, so you get to be really, that's the problem with, one of the problems is, I'm having a little work done. Oh, that's so cute. I'm having a little work done. I'm having my nails done, a massage, and I'm going to do my facelift. Well, you're going to be put into a chemical coma
Right.
to do your facelift. Your face is going to be sliced open and We're going to be just at the layer above the nerves, particularly with this new kind of deep plane facelift we do. This is some serious stuff with a lot of serious. Unfortunately, one of the best dermatologists, this is a right now kind of thing that just came out in the media yesterday. But arguably the most famous dermatologist, who you may or may not have heard of, you probably haven't, in Beverly Hills and Los Angeles, who within the dermatology world is a true legend, passed away in the last 2 weeks having neck surgery done.
No way.
Yeah.
It's wild.
Yeah.
Well,
So this is like, be careful.
And is it, no negligence has been revealed. It's just sadly one of those rare cases where someone,
I don't know.
will be revealed?
I have no idea. I mean, I sort of do, but sort of don't.
Fair enough.
I don't enough to actually definitively tell you, but I mean, if you have someone who's board certified in plastic surgery do your face and neck lift, the chances that, for example, we'll lose the airway and you'll die, I mean, it should be pretty close to zero, because at the end of the day, even if everything goes bad, I can still cut open your neck and gain access to your airway.
Right.
And
tracheotomy,
and you're not going to die. But if you're having, and I don't know about him in particular, although I sort of, but I don't know. But if you're having it done by a person who doesn't know how to do that because they're not a real plastic surgeon, and that happens, you're
all bad.
All bad.
Well, that's why, I mean, that's basically how they lost Joan Rivers.
Exactly. Well,
from neglect. Like
that was okay.
They were taking a selfie with her.
You have a problem with this, theoretically. You're operating on a celebrity, okay? Yeah. And celebrities can manipulate. There's this thing they can do with their surgeons. Oh, I'm taking care of Joan Rivers, and maybe I'll just do a shortcut, and I won't do this, and I don't want to mess up. She's telling jokes next week, and we're just going to take a look at her larynx and see if there's any polyps. And they sort of, well, they don't do the, hey, if A, then B, if B, then C. They go, well, we don't want to, do anything too aggressive, and they just let her die.
What does that mean? Because
she's a celebrity.
Flatlined. Something really bad happened.
They lost the airway.
They couldn't cut into her neck the way you said.
They were in a major Manhattan facility with major league famous surgeons who, under normal circumstances with a civilian, this never would have happened. But because she's Joan Rivers, okay, they sort of, this is why you're not really supposed to treat your family members, because you may do something that you normally don't do.
Sure.
And let me ask you, Dr. Dubrow, like, and I know your history, general surgery, UCLA, like you've really been through the gamut.
Yes.
I have a close family friend who's the head of chief of plastics at St. John's.
Okay.
And she always says, I only work with anesthesiologists who work with sick people.
Yes.
Too. She said, because it can be easy to be lulled in when you're only dealing with healthy people coming in for elective surgery, to not, when something hits the fan, to have to be rusty. How many surgeons like you would feel comfortable, in the God forbids, to do a willy-nilly tracheotomy? Like,
I think almost
on the spot.
Most plastic surgeons would.
Really?
Yes. But remember, more than 50% of cosmetic surgery are done by non-plastic surgeons in this country. Yeah. And even in Beverly Hills, probably 60% don't really have any training necessarily in plastic surgery. So all of those dermatologists or rheumatologists or general surgeons, they don't necessarily know what to do because they're not specifically trained, haven't been tested it, are not really certified in that. So that's the problem. Is the people vaping, doing Zins? I know that nicotine can sometimes mess with recovery and blood vessels. Is that starting to play any part in people that you're seeing? I thought that was going to be a problem, but if you're doing smokeless, Zin nicotine, obviously I wouldn't operate on you, but I haven't really seen an uptick in vascular compromise, which you would expect from that thing. Yeah. So, I mean, we still ask. So you have to sort of lie to your surgeon. Yeah, I don't do it. Because if you say, yeah, I do nicotine patch, they go, okay, well, I'm going to test you for nicotine. 3 days before, I'm going to cancel your case. So you have to be off it for 30 days. But, I had a patient that I canceled. She signed up for a tremendous amount of really interesting, challenging revisional surgery, and she really needed it done. And we gave her a prescription for some narcotics, and the pharmacist wouldn't fill it. We went, what? And so we ran what's called a cures on her. A cures is this sort of test that we doctors can run on you to see what prescriptions you had. We can do it without your permission.
Wow.
And we're supposed to do it if we're giving you narcotics. And she was on narcotics for the last 6 months, like tremendous amounts. And I said, okay, there's a problem here. You've got a major disorder here. And so I canceled the surgery. But had I not figured it out, imagine all the pain she would have had post-op. And what am I going to do? She is already on narcotics. There's nothing to give her. Yeah. She would have gone crazy. It would have put her in the hospital. You know?
So Terry, since you were last on the podcast, and by the way, for those of you that haven't listened to that episode, it was unbelievable. And we very rarely have a repeat, okay? Because we don't like repeats. But you're fantastic, and we wanted to have you on again. Emilia Perez, I don't know if you saw it, but this movie came out. It's all about how a drug trafficker transitions to lead a different life. And simultaneously, because as Josh knows, I only watch TV shows 20 years later, my wife showed me Nip Tuck. And I'm watching Nip Tuck, which I'm sure you're familiar with. And I'm thinking to myself, okay, is this because there's an episode where a criminal comes in and wants to have plastic surgery so they can sort of be off the radar? Have you ever has that ever happened to you? Have you ever had somebody come into your office that sort of wanted to change identities?
No, no, because it doesn't really work. Although some of the deep plate facelifts are really making people look different these days. Have you noticed that?
Will you define what that means, deep plane?
Okay, so there's various kinds of facelifts, right? The sort of original facelift is a skin-only facelift. You make incisions in front and behind the ear, and you simply lift up the skin and just pull it back, cut it off, and do it tight. Those don't last very long, and they can look a little waxy and weird. Then we started to go into the deeper layers, because when your face ages and you get facial deflation and droopiness, it's not just the skin, it's all of the layers. The skin, the muscle, the soft tissue, the fat, everything. So the deeper you go and take the entirety of the face and put it back up, the more sort of restorative and the longer lasting theoretically it'll be. The problem is the deeper you go, the more swelling. The deeper you go, the closer you are to the facial nerves. The closer you are to the facial nerves, the greater the chance that you'll injure them. You'll end up looking like you had a stroke, right? Which is a devastating complication of facelift nerve injury. Mm-hmm. So but most of us who do them know how to do them with a low risk of nerve damage, right? And so swelling, all right, lasts a little bit longer. But when you're looking at some celebrities who will go unnamed, you can figure them out. They're looking amazing, but they actually just don't look like themselves. It's sort of Don't Put Baby in a Corner. Remember the movie Jennifer, what's her name, who had her nose done?
Jennifer Grey.
Yes.
Jennifer Grey.
Jennifer Grey, what was the movie?
Dirty Dancing.
Dirty Dancing, okay. She had sort of this nose. I don't know if you guys are maybe too young to know this, but I don't know how you know it. But if she had her nose done, well, she did Dirty Dancing, giant hit, big star, her and Patrick Swayze, right? Then she has her nose done. She takes off sort of this ethnicity to her nose, and she has more of a sort of a aesthetic nose with no bump, and her career was over instantly. She didn't look like Jennifer Grey anymore.
Weird.
Done. And so you look at someone like, for example, Lindsay Lohan. She does look amazing, but she looks very, very like. Would you recognize Lindsay Lohan now?
I think Lindsay Lohan looks how Lindsay always wanted to look.
She looks gorgeous.
She don't look like a girl from Long Island no more.
Right.
Like
she looks amazing.
And I think she has some of the best work I've ever seen, maybe.
And so does Kris Jenner.
Yes.
But, do they look like they're very good? But if, you have a certain look and it changes.
Her look definitely changed. I would agree.
If it changes, it may not devastate your career like it did with Jennifer Grey, whose career was literally overnight ended with that nose job, Wow. So if you got to be careful, because if you like the way you look and suddenly you're looking to your friends like, you look great, but who are you? You got to be careful with these kinds of facelifts.
What about it's been alleged, but someone like Brad Pitt looks
Amazing.
spectacular.
Amazing.
And looks like himself.
He does.
It's just because you look at someone, I think they're about the same age, like Tom Cruise and Brad Pitt. And I'll give them both credit. Like, I think Tom Cruise looks amazing too, but is okay looking like a guy in his early 60s.
Exactly.
Where Brad looks like he's 40.
Brad looks amazing. You know, it's funny. I once did this very famous person, and I did her facelift, and she looked amazing. Everybody said, "Oh, you did such a good job." I go, "Yeah, but she's like a 10. If you operate on a 10 and you like take off 10 years, what do you get? You get Brad Pitt."
Right. Yeah.
It's like cheating. You know, you don't have to make Brad Pitt look different. You better not make Brad Pitt look different. Could you imagine? Take away Brad Pitt's Brad Pittness. I mean,
you're done.
You'll
never work in this town again.
It'll be a Jennifer Grey thing. You know.
So what is Brad Pitt doing? Like, what is Brad Pitt doing to look like that?
Well, I don't talk about celebrities. I don't know exactly what Brad Pitt did, but to me, if I had to guess, I say he just had a really well done sort of natural facelift. You know, he looks amazing. Wow.
I'm in. Listen, I'm going to be 40 next year.
You look great.
Terry,
I know you lost a lot of weight, right? That was your thing. A ton of weight.
I did.
It doesn't.
God bless you.
It doesn't show on your face. Well, you lost it young.
I did.
So it didn't affect your face.
I was very lucky. As you know, I had a little blepharoplasty 2 years ago.
Which looks great.
Shout out Dr. Groff. Love him.
Oh, he's great.
Yeah.
I brought him on season something of Botched.
He's a genius.
Brilliant surgeon. Yes.
And it's funny that you're giving me the perfect transition. I do have one little insecurity, and we're gonna have honest little corner
probably
right
your stomach,
now, guys.
Right?
Stomach's gorge.
Oh, really? Okay.
Well, because I had a little.
You had a little thing done.
Tuck,
Okay.
Is that I have a little skin around my chest.
Yes.
And I've watched you do one, and I've done the gamut. Sadly,
you're afraid of the scar.
It's not afraid of the scar. It seems to me, whether you're one of the greatest surgeons there are or any other surgeon, you are limited by just the realities of where it is on the body anatomically. Right. And I've never seen it look amazing.
Yeah.
I've seen it look better. What do you think? And should I take my shirt off?
Yeah, go ahead. If you want to, if you're comfortable.
We're cutting this out.
Yeah, you can cut it out.
Hold on. Let me move her. Can I do some push-ups?
If you just give me a quick.
I don't know why I'm squatting.
But what did the squat do?
I don't know. I also have a birthmark that looks like South America. Don't you judge, Dr. Dubrow.
Me judge? You kidding?
Okay, ready? Here we go.
Yeah, so
it's actually not terrible.
Bad. No, you just have. By the way, you just have that. That's a pretty easy sort of. You've done well. You just need a little tightening.
I just walk around the pool like this. I hold it back with my arms. My nipples are just like.
But you could do. You know, you're one of these staged people, whereas you could do just a little bit
around the nip,
and then pull it up a little more.
Can you turn my nips from $50 to dimes?
Yes, but here's where that gets very.
Josh, he's a slippery slope. Josh is gonna.
Yeah, no, you look good. You look good. You just need a little. You need a little. Oh, that was for the push. You need a little, just a little more tightening.
Really?
Yeah.
Okay. What about this?
Yeah.
Are you sure?
Well, okay. There you go.
I make it look a little.
So you're right. What you don't want, you need that hockey stick thing.
That's not good.
I know.
And it never
on a guy,
looks great.
Women are happy to do that because they don't walk around with their tops off at the beach.
Right.
We do.
Right.
So they'll take the scars. It's always, is it worth it? Does the advantages outweigh the disadvantages? In your case, you're not comfortable with it.
So you can't fix it. Really?
You can, but not without that little hockey stick thing.
On both sides.
Oh, yeah, because it goes off what we call laterally into the side wall. So you have to go where it goes. Unfortunately, you can't just do it with just an around the areola thing to get that sort of pulling in all dimensions. You have to chase it out laterally out here on the side of the chest wall.
And they call me Joshy Keloid. So I'm gonna get a thick scar. Probably. I mean,
I doubt it.
I feel like this area, because you're always moving, it tends to get to scar poorly, right?
Not, where it tends to keloid down the center. It's funny because a patient will come to my office and they want all this surgery done and they're a good candidate. I inform them all this risk. And they go, yeah, you're going to do it in 6 months. But in the meantime, would you take a little mole off in the center of my chest? You go, oh, because this is a very high keloid. And so you think if you take this little thing off into keloids, they're going to cancel the case because you think you're a loser. And this is just a prone area to do it.
Right.
Yeah. But someday I will bet you that within 10, 15 years, maybe, that will loosen up enough that you'll go, screw it, make that incision out.
Oh, is it going to get worse?
Well, I mean, all
Just
our skin.
naturally.
Yeah.
F, dude.
No, you're in good shape. You know, you're not
trying.
Your weight doesn't. You know, it's funny. I think last time we talked, was I fascinated with the GLP-1 drugs?
Oh, let's
the Ozempics.
we
Hold
were-
on. I'm
we
going
were
to
in
get
our-
you guys chat. I'm going to get a fan real quick because
Yeah.
I'm schwitzing.
Yeah.
I was on it. We spoke about it. I'm still on it. I've kind of plateaued. I went from Ozempic into tirzepatide. I don't take enough of it.
What's
I'm
your
happy
dose?
with my weight. I take 35 milligrams.
So you're on a compound. You're not on the regular one. Huh?
I'm on the compound.
Yeah. So you
tirzepatide.
can't. It's hard to compare.
Yeah.
the compound.
I've never been on a very high dose of any of them, though, because I don't like that feeling, which is so counterintuitive to what the drug is. I don't like that feeling that I can't finish a piece of chicken. So I'd rather just I'm living 50 pounds lighter than I was.
Isn't that wonderful?
It is. I'd like to be 70 pounds lighter.
And what's your hemoglobin A1C?
Oh, I have no idea.
Oh, because you never had a diabetes thing.
Yeah,
insulin
no.
resistance.
I know my blood work is good.
It's good.
I know my blood work is great.
Okay.
Yes,
So-
I had that recently.
So I am obsessed with these drugs. And I
Tell
think
me.
these drugs are one of the most important medical advances in history. I got so obsessed with it. This is so me, by the way, but I got so obsessed with it that I started talking about it in the media, and Jillian Michaels and I went back and forth. She said, you shouldn't do these drugs. I go, you don't know what you're talking.
When you came on was when you were in the feud with Jillian Michaels, that exact week.
Okay, so that funny. So I thought to myself, I am a doctor. I am board certified. I was board certified in general surgery, board certified in plastic surgery, but I'm not truly an obesity medicine expert. So if for me to, with great confidence, talk really in the media about these drugs, I should become board certified in obesity. So I actually took all the courses and I took the exam, and last November I got board certified by the American Board of Obesity Medicine.
Wow.
So this is like a true expert thing for me now. I'm totally into it and I'm board certified in it. And it's something that I think is really important. Even though it's not my career, I don't prescribe obesity drugs as a career, but I know everything about them. So I'm obsessed with these drugs and what they do for your general health above and beyond what they do for obesity.
You're hot, Dr. Nazardin. Wow. I love this new chapter.
So what's your favorite of the GLPs?
What's
your favorite?
I'm waiting for the next one.
Is it
Yeah,
Retatrutide is the next one?
That's the next one that I'm waiting for. You guys really know your stuff.
It's a GLP-3, my G.
That's right.
Yeah.
But,
We
the
love
one
it.
you're on, tirzepatide. It's the
Tirzepatide,
GLP-1, which is Ozempic, and the GIP. So, as you know, there's Ozempic and Wegovy. That's the same drug. That's a GLP-1. And then there's Mounjaro and Zepbound, same drug, called, that's the GIP and GLP. And those are amazing and they're powerful. But I'm into them for another reason. Even if you're not overweight, I think it's the ultimate anti-aging drug.
Really?
The ultimate longevity drug, because it's all about insulin sensitivity and reducing inflammation. So I'm very into this new thing that you can find people are talking about it on TikTok. It cracks me up, but microdosing. Low
Interesting.
dose tirzepatide, low dose GLP-1s and GIPs that are cardioprotective. They're good for your brain, your heart, your lungs, your kidney. They're good for addictions. They're good for everything. I am convinced this is the next longevity drug of the future.
Fine, I do it.
Yeah, it's
Do
really.
it, Josh. Just microdose a
I
little
do
bit.
it.
Wait.
You
Oh,
do
you
do
do.
it.
I've been doing it for the last 2 months.
So what's your dose?
A microdose.
Okay, so
What the hell? You've been keeping
this
this
interesting?
from me.
I'm changing, okay? Things have changed for me, Ben.
I'm glad you do it. I'm glad you do it.
Yeah.
So do you
I feel so naked and afraid and alone. I'm alone in the dark.
That's so
That's
funny.
crazy.
It's a micro little cutesy. It's a micro mini cutesy
Okay.
dose.
So what have you
take-
noticed?
What are you
What have
taking
you
and what's
noticed
your
about
dose?
I haven't noted.
What about the food noise? A little bit better?
Here's the thing. I lost 100 pounds when I was 19.
Yeah.
Right? Like I completed losing weight. I've kept it off for 20 years.
Okay.
So it's a real lifestyle for me now. And I'm a sober guy. So like I know that food was probably just my avenue because like for most kids who are chubby, like they overindulge. But then when I lost the weight, I realized, oh, I could do this with alcohol. I could do this with a million things. So it's really, I've had to work on my brain. What I've noticed is it just like the real dirtbag food, like the real gas station craving kind of is easier to sort of let go of.
Right.
But to your point, I take half of the minimum dose.
Right.
Shout out the great Craig Conover, hooking it up. Yeah.
So you do exactly what I'm telling you. What I'm hot for.
Is that what you're into?
But how many people do you know who do
Josh?
this? Maybe in LA. You live in LA.
Sure.
So you might know a lot of people who microdose. But this is not a thing yet. Have you heard much about it in the media?
Only from like longevity people. But
Right.
yeah, this Craig Conover Wellness is great peptide therapy, longevity doctor. And he sort of suggested this to me. And I was like, listen, I would at least like to see it and not just wear it as some badge of honor that I never touched it. And it's interesting. I don't know if I'll do it forever, but I'm interested to see.
Which one are you on? What are you on?
Tirzepatide.
Yeah.
Tirzepatide.
That's the
you're
Mounjaro
on-
Zepbound one. Yeah.
Got it. And so you're on half of the minimum, and you take it once a week. Same thing.
I even I do it like once every 10 days.
Yeah. That's microdosing.
Wow.
I'm so happy to hear you doing that because I am absolutely convinced. And when you look at the data, okay, really not the ChatGPT data, although that's good, but there's another app called Open Evidence that if you have an NPI, National Practitioner number that you get for free, and you put in microdosing, you put in tirzepatide and its effects on inflammation and life extension, the studies from the New England Journal of Medicine, this is real stuff, are really profound how effective it is. It's just nobody knows about this yet. And I'm promoting Botch Presents Plastic Surgery Rewind right now, right? So I was on the Today Show Monday and I did KTLA this morning. I'm talking that. What I really want to do though is go around and talk about microdosing of these medications because I think it's just not out there yet. And I think if you could it's all about reduction of inflammation. That's what this is about. And because the more sugar you're exposed to in your circulation, the more inflammatory effects you're going to get. And that's the ultimate anti-aging thing to do. So I love that you're doing that.
And was it overblown? I feel like what we're finding out is like any diet, that if you aren't supplementing with weight training and getting enough protein in, of course you're going to have skin sagginess or lose muscle mass, but that it wasn't any worse from taking a GLP-1.
Well, it is. I'll tell you why. Because
I was going to, yeah.
You do know. Tell us. Go ahead.
I do know because when I first took Ozempic, Josh knows I was in a really, really, really great gym groove too. And then I went off it because my wife and I were trying to have our first child. He's now 7 weeks old. We did that. I went back on. And since going back on, I have found it absolutely impossible to get back in a gym routine. And when I tell you I am achy, I am weak, and I know I have to do it.
Yeah.
I have to. But without it, it really is, it's bad. It's bad.
Right.
I'm noticeably weaker.
Yes, but let me just tell you something about the GLP-1s and the tirzepatides and so on. So on a regular diet, based on proper eating and exercise, the weight you lose is 75% fat, 25% lean muscle mass. When you're on the GLP-1s, you lose 50% of the weight is lean muscle mass. And that's the stuff you want to preserve. Okay.
Sure.
So you want to lose fat and not muscle. So when you go on one of these medications, even microdosing, the first thing you have to focus on is increasing your protein, which you have to do. And the second thing is, you have to do resistance training. You have to beef up your lean muscle mass because these drugs will make you lose muscle. And that's not good. And that makes you older. Not only does it make your skin sag and so on and so forth, but you want to lose fat, not muscle. So if you're going even on microdosing, up your protein and get in the gym. And it could be bands. It could be, you don't have to sit there and I lift weights when you first walked, you said, what do I do for workout? So after this, I'm done for the day, because I did PR today for Botch Presents Plastic Surgery Rewind, 10 o'clock on E. and then Peacock after that.
This man knows how to sell.
Yeah, I know, But so we have a gym in this apartment Heather and I moved into in LA, this really great gym at the bottom of this building of.
Beautiful building.
Yeah. And I will lift weights for an hour and a half. I mean, I'm 66, so I'm not going, but I do, Oh, and by the way, creatine. I don't know if you're on creatine. If you're not,
10 milligrams minimum.
Greatest thing ever, right? Closest to the steroid you could possibly get without having any side effects.
Been around forever.
But recently, weirdly, has blown up.
And you get it from meat naturally, right? But yeah, I take it, and Ben stopped taking it because his wife thought he was doing drugs. She didn't like the look of it.
You were getting big?
No, I think she just saw I put a little into a plastic bag because I was going on vacation, and she literally thought it was cocaine.
Were you snorting
it? I wish. Now I'm thinking about it. Josh, I think I need to go back on creatine.
You do.
That will make me want to work out. Because when I was on creatine, I do, right?
You have to go back on it. So anyway, I will lift weights I will have my creatine. I have 10 grams. The ideal dose is 5 grams. But anyway, I do a little more.
But if one is good, two is better.
You can't, it doesn't hurt.
Me and Terry have broken up. Fun.
I know, right? We're going to snort some creatine later. But
the title.
I'll lift weights for an hour and a half, and I will take out my iPad, get on the treadmill, and do my zone 2 cardio, which is 60% of your maximum heart rate for 90 minutes. And I'll spend 3 hours in the gym.
No, you won't.
I will. And what's good is I'm in an advanced stage of my career. I'm very successful. I don't need to worry about paying the overhead. I don't care if I operate or not, but I do operate all the time. But I'm more focused on what am I doing on a daily basis. The minimum I will do is 60 minutes of cardio. And I do this every day. Now, nobody can do this because, we all have lives and you have kids and so on and so forth. So I don't expect you to do this, but you got to do something every day.
3-hour workout every day. 5 days a week?
No, 7.
Unbelievable.
7 every day.
And your wife must love it because you're out of the house.
That's true.
That's what my wife would love.
It's true.
She'd be like, go to the gym.
Well, the gym's
Get out of my hair.
downstairs. So it's been, ever since we moved up to Beverly Hills, it's been more convenient. But this creatine thing, everybody, particularly women, should be on creatine, but it doesn't work if you don't get more lean muscle mass, if you don't do resistance training. And it works beautifully in women. The only downside with women is, and maybe even those of you, how often do you step on the scale?
I try not to, but no, at least once a month.
Okay, but not every day.
Yeah.
If you step on the scale, you retain water, you're going to be 3-4 pounds heavier. And you're going to think, oh my gosh, I've gained all this weight. It's the creatine. I can't stand this. It's just water weight. But creatine.
I'm laughing because I have such a toxic relationship with my scale that sometimes I'll weigh myself at night after a full day of eating, just in case it looks a little bit better. I'm like, oh, not so bad. Maybe in the morning,
Oh, so that's your baseline.
That's my baseline.
Oh, okay. That's smart. So yeah, I mean, but you have to lift weights if you're going to take creatine.
What about, and I pick on my Benny boy because I just love him so much. I love this man and he's amazing. He's an amazing strides. I give him a hard time because he loves a good supplement. And so he'll take plenty of turmeric. He was on a saffron kick for a while. His stomach was like an Indian restaurant. And he loves a good supplement. But I say, if you're not working out regularly, it's like
a waste. Why bother?
It's a garden hose on a fire. Like working out far and away is the greatest longevity hack. Yes.
If you could pick working out versus stop smoking, working out.
Wow.
Stay smoking versus not working out and quitting smoking.
Or rip a cig on the elliptical.
I'm saying.
I'm in.
Can you say Planet Fitness?
Start smoking, start working out.
Yeah.
That's what I'm doing.
No, I'm just saying it's the single most important life extension, health span extending activity thing you can do. For sure.
All right.
You got to do it. But
I got to
so
get back
creatine, my agent wants me to do a podcast, right? Because then not because I have so much to talk about, but I do these experiments on myself and I come up with these conclusions, right? And he wants me to do a podcast where I'm visually showing these experiments that I'm doing on myself. For example, half my face, I'm going to do a Morpheus, okay? And to tell you whether these new sort of non-invasive facial tightening things work or not. But to this point, I went on creatine and I didn't change my weightlifting at all. And I just said, I'm going to do the same weights. And so I do the same weights because, at my stage, my goal is not to get huge. It's just is consistency, right?
Sure. So
I do this one weight thing. You sit, you sort of do this pushy thing. It's sort of the easy equivalent to a bench press, but you sit and do it, sitting bench on a machine. So I do 4 sets of 12 at 100. Now, creatine, I'm up to 150 for the same effort.
Hell yeah.
50% stronger just from creatine.
Wow. I'm in.
This episode of the Good Guys Podcast is brought to you by our friends at Nutrafol. Folks, we love Nutrafol here at the Good Guys Podcast because we acknowledge the fact that we are losing a little bit of our hair, okay? We're shedding, folks, and I need you to understand this respectfully. You're shedding too. You're listening to this podcast, you're probably, early 30s. You could be mid-20s. You could be younger. You could still be shedding. You could be older, okay? I love our 60-year-old morons. You could be shedding 70, 80. You need Nutrafol, folks, and it's not a slight. You need it because your hair will look better. You will feel more confident. I'm telling you, folks, everything changed for me when I switched to Nutrafol. An investment in your hair is an investment in yourself, just like hitting the gym or upgrading your wardrobe. Taking care of your hair can boost your confidence, I know it did for me, and help you look and feel your best. Today's sponsor, Nutrafol, sponsors hair growth from within, targeting root causes of hair thinning for visibly thicker, fuller hair in just 3 to 6 months, so you can show up as your best self every day. Folks, Nutrafol is the #1 dermatologist-recommended hair growth supplement brand, trusted by over 1.5 million people. See thicker, stronger, faster-growing hair with less shedding in just 3 to 6 months with Nutrafol. Thinning hair is different for men and women, so one-size-fits-all approach simply doesn't cut it. I'm telling you, folks, Nutrafol has multiple formulas for men and women that are tailored to different life stages. Postpartum, menopause, maybe a plant-based diet, maybe a keto season diet. Who knows? I'm telling you, folks, Nutrafol's got it for you. Plus, users of Nutrafol men reported no impact to sexual performance. Thank God, okay? Thank God. So, folks, to start your hair growth journey with Nutrafol, for a limited time, Nutrafol is offering our listeners $10 off your first month subscription and free shipping when you go to Nutrafol.com and enter promo code GoodGuys10. Find out why Nutrafol is the best-selling hair growth supplement brand at Nutrafol.com, spelled Nutrafol.com, promo code GoodGuys10. That's Nutrafol.com, promo code GoodGuys10. This episode of the Good Guys Podcast is brought to you by our friends at Prolon. Folks, swimsuits, sunrise, and spontaneous plans. Yep, summer is here. But if you're not feeling it this season, I've got good news. Prolon's 5-day fasting mimicking diet is your summer-ready secret weapon. The ultimate tool for a metabolism reset, fat loss, lean muscle protection, and more. Prolon delivers a summer glow-up from inside out. And in just 5 days, it's my secret weapon. I'm telling you, how easy is that? And it totally works because Prolon is a plant-based nutrition program featuring soups, snacks, and beverages designed to nourish the body while keeping it in a fasting state, triggering cellular rejuvenation and renewal. Next Gen builds on the original Prolon with 100% organic soups and teas, a richer taste, and ready-to-eat meals. Developed over decades at USC's Longevity Institute and backed by top U.S. medical centers, Prolon has been shown to support biological age reduction, metabolic health, skin appearance, fat loss, and energy. Folks, I'm telling you, Prolon is it. Whenever I'm feeling a little bit bloated, maybe the shots aren't doing what it needs to be done, I'm telling you, Prolon, you gotta give it a try. And folks, for a limited time, you can be the first in line to experience the Next Gen, their new Next Gen, at special cost savings. Prolon is offering Good Guys listeners 15% off site-wide, plus a $40 bonus gift when you subscribe to their 5-day nutrition program. Just visit prolonlife.com/goodguys. That's PROLONLIFE.com/goodguys to claim your 15% discount and your bonus gift. prolonlife.com/goodguys.
And what do we have a brand that we're loving?
No.
Do you have a brand?
No. Creatine monophosphate, Amazon. I mean, I like the one called Naked Creatine, but it doesn't matter. No. any of them, they're all equivalent. Just go for the cheapest one because nothing special about creatines, right? But it's great for your brain.
You hear that, Josh? Nothing special.
Thorn.
About
I love
individual
Thorn.
one. Unless, of course, you guys have a branded
We
creatine.
don't. I just use.
I'll
I
say
like
yours.
Thorn.
Yours is the best.
Do we, Olivia? What's that? There's a creatine.
I think we do maybe.
Momentous.
Omega-3 Momentous?
Momentous
Yes.
creatine, yes.
You gotta
Pure.
use. Yeah.
Does it have?
except for-
Does it have omega-3 in it?
yes, it does.
Well, that's different. That's cool because now you're
Yeah.
getting your omega-3. So I would.
It's a combo.
I,
it's
that's
like
that's cool. I would endorse that.
protein, creatine, omega-3s, the
Yeah.
Momentous 3. It's
I
fantastic.
think that's very cool. Yeah, it's one of your sponsors.
Yes.
Yeah, no,
yes.
I think that's a wonderful thing to add to it. So I 100% agree with that. But if you're just buying creatine, you don't go for the expensive one. They're all the same. You know what I
Understood.
mean?
Okay.
Is there any plastic surgery trend right now? Anything that's popular that you think is going to that you don't like? That is going to
Oh.
have some bad.
Yes. So last time I was on, I'm sure I talked about Brazilian butt lifts that I hated.
Yes,
Okay,
they're very
yes.
dangerous.
They're
right?
very dangerous, and that's because there's these blood vessels in the buttock that are not that deep. That if you get into them, they go right into the vena cava, which is the main vein going back to the right side of your heart. And if you inject fat into those by mistake, and remember, it's a blinded procedure. It's not like you're opening up the buttock. You go, oh, I'm going to lay it right here. You put it through a teeny little incision, and you go, here's hoping it goes in the right place. You know, you don't know, right?
Right.
So if you get it into one of those veins and it goes up into the vena cava, into your heart, to your lungs, you die instantly. And, you know, I work for the California Medical Board, and I do have a very big medical legal career where I'm against doctors and for doctors. Okay. I work both sides. I just tell the truth. I'm a medical legal expert. Okay. In court,
Sure.
I'm in court all the time doing this stuff. And even when done by the best surgeon under the best circumstances, if you get in the vein, you probably will die. And great surgeons have lost people in their office on the table from this procedure. No procedure that has that possibility, in my mind, is worth it. Having a bigger butt is not worth risking your life. Okay. So that one I talked about last time I was on the show.
Yeah.
I think, you know, people are still doing a lot of filler. We are and on Plastic Surgery Rewind that's on tonight. Is this going to be on today? No, it'll be on in a couple weeks. This
But
podcast.
when is it on?
It's
in
on.
time?
It's on Wednesday nights at 10 p.m. on E. This new show. A lot of our celebrities had a lot of filler done very early, and you think filler, hyaluronic acid, you could just inject hyaluronidase, which is an enzyme that just dissolves it. Right? No harm, no foul. Don't worry about it. Oh, first of all, it's a commitment. If you can get scarring from it, it can migrate, it can get into the blood vessels, it can give blindness, and these things happen.
Mhm.
Okay, they happen, and they happen frequently, and it can make you look older, even if you don't have a complication. So, filler, we're doing too much filler in this country, and patients are not being told the truth about how it should be done and should be doing less. I still think it's fine if you do it in the proper places where the tissue's thick. Stay away from the eyes. Don't do it in the lower eyelids, you know. And I would prefer you didn't do it in the lips at all. But I think filler is much more dangerous than plastic surgeons and other doctors are willing to admit. So that's sort of number one. And the reason I want to mention that is because how common is filler?
Very.
Very common. I think it's just, and if you watch Plastic Surgery Rewind, you'll see how regretful these celebrities are about their filler. So filler, the big new horizon in plastic surgery, you know, I went to med school 82 to 86, a long time ago. But if you would have told me when I graduated UCLA med school that in 2025, which is what, 39 years ago, right? 86 to 25, 39. Something like that. No, 16 plus 25 is 41. 41, shit. Anyway, excuse my language. That in 2025, you're still going to be taking a scalpel, cutting, lifting, cauterizing, destroying blood vessels while a patient's under a chemical coma, pulling back and stitching things closed. I would have said, oh, come on. 40 years from now, we'll be doing laser. You'll get into this tube, and all of a sudden you'll come out a younger version of yourself. We're still doing the exact. Yeah, we go a little deeper. We do a deep plane whoop-de-doo. We still do the same instruments, same sutures, same trauma, same risk of complications as, in fact, more than ever before. So we need to figure out, and we're slowly getting there, how to deliver energy to the skin,
right?
To make the elastin and collagen thicker, to do all those things that nature does for you when you're very young, right? But we're still doing them with surgical techniques. It's crazy. That's where we're at. The problem is, overpromise, underdeliver. A new device will come out. They'll sell it to the doctor for $175,000 with the promise that it's going to do this for the patient, right? And the doctor goes, okay, I can see how much this cost me, $8,000 a month on my lease payments on this new laser. And they sell it to 2,000 patients, and it doesn't really work, or it burns them. Have you guys heard of these new devices that you put underneath the skin, these J-plasma devices?
No.
You make a little incision. It's all about skin tightening, right? The holy grail in cosmetic medicine is skin tightening, isn't it?
Yes, can't relate.
It's all skin tightening. I mean, if you could go to the face, no one would ever need a facelift. You wouldn't have to cut anybody open, right? Well, we started on the outside, lasering and applying these energy transmission devices. And we said, well, what if we heat the skin from the inside? Makes sense. Heat it from the inside, do it with either laser or this energy transmission called J-plasma or some other kind of, ultrasonic device. If you can get this energy delivered to the inside, it will tighten the skin from the inside, right? Except this J-plasma, I mean, I saw nothing but burns on people for 2 years.
Barbecue.
It's unbelievable.
I'll tell you, you'll like this before we get to our what are you nuts. I have a friend who's a surgeon who was on call for the ER. Someone gets brought in with they had a tummy tuck and they were having complications and it needed to be reopened. So they call in my friend. And so she puts out a call to the plastic surgeon who did it, who's now on a trip. Is flying. And she goes, hey, I just want to ask the doctor what their approach was so that I can go in and do something complimentary and not disrupt it too much, because reopening it is less than ideal. The nurse calls back and says, the doctor's approach for a tummy tuck is it's actually patented the way he does it. And so,
which of course is BS,
God.
as you know.
It's
You can't patent a surgical technique.
You can't patent cutting.
No.
And
wouldn't tell her.
My doctor friend said, you have him call me immediately.
Yeah.
Or I'm going to report him to the medical board.
Exactly.
And of course he did right away. But she was like, patented.
What a joke.
Nuts.
That's a marketing thing for patients. There's a facelift surgeon here who will go unnamed, he made up a name for his facelift that's based on his own name.
We've had him on the show.
Okay. Never mind then. I'm not saying it's that guy. I don't know. But never mind, because I was going to tell you some things, but I don't need to tell you some things. It's good.
Well,
all good.
I would still love to know. He hasn't come on twice.
Yeah, he hasn't.
He's not a repeat.
I mean, the guy I'm talking about is, very talented, but, he named a thing after us and charges in the multiple hundreds of thousands for this thing. And like every other procedure, it can go south on you. Okay. That's enough said. And just, there's just a lot of stuff out there that we plastic surgeons tell people.
I will say he was lovely. That said, he was a master marketer of his own products. That's all.
But
That's all.
do you want to be?
You don't do that. You don't do that.
I don't. You could. Okay, you don't want to be marketed into a potentially life-threatening procedure.
Right.
It's one thing to, okay, I bought this car. Maybe I didn't like it. Maybe I thought I'd be sexy driving around this car. Through marketing, they got to me. I could look like James Bond in this car. A surgical procedure. But one could argue that I use my status on a reality television program and talk about how honest I am as a way to get patients. Well, he's so honest, maybe I should go to him.
We all like it just because you pick on doctor.
Very cynical, by the way, and it's not true, but one could say that even about me. that I'm here for marketing.
No, it's all because of how hard you are on Dr. Nassif.
I know.
That's why we love you.
I know.
You really grind his gears. We love it.
But he can take it.
Here's a fun little cliffhanger because I hope you'll come back on.
Yeah.
And we've talked about this before, but I truly think we would need like almost a whole episode on it, and I would love it if you'd come back on.
Yeah.
About how I had plastic surgery when I was 19 years old.
Yeah.
And I was badly botched, and I learned something new about it from a recent surgery I had, a new revelation.
Oh, tell me.
About the doctor, it's a whole, I'm making it a
you're going to
cliffhanger.
leave? Oh.
Come back. Will you come back?
Yes. Oh, absolutely. I love you guys.
It's a good story. It's a good story.
Just so you know, not that I'm so special because I'm not, but I get asked to do podcasts 3 to 4 times a week. I really do. I say no to every single one. Didn't I just get asked? And I looked at it, I went, oh, he talks about interesting stuff, but I'm just too big. When I heard you guys wanted to chat again, I go, what did I say? I said, absolutely. I love those guys.
Oh my gosh, I'm plotting.
I'll come back.
Plotting.
I'm telling you the truth. I'll come back anytime. And I was glad that I got to do it with you. And next time I'll come back to New York because I love coming out to New York. And
beautiful.
Any excuse to come out there and eat the restaurant.
Josh will come to New York too.
Yeah. How often do you go out there?
Usually once or twice a year.
Don't you love it out
For
there?
For you, I'll come back.
Yeah.
We'll
all go out on me. We'll go out. I'll pick the restaurant. Although
gosh.
you probably eat in a very particular way, don't you?
No, I'm done with that.
You eat.
Oh, please.
Are you an eater?
Am I an eater?
How could you not be in New
How
York,
could you
right?
how could you be on trizepatide and not be an eater?
I know.
I'm not on it for the longevity.
So true.
To lose weight.
The 3 of us in one recording studio, there'll be so much tea going on. The amount of testosterone in that room.
By the way, are you on testosterone?
I'm not yet. I'm 39. It's
you're way
early,
too young.
right?
Way too. Yes, but some people just do it anyway. You know. But
and just warn me before this dinner. Give me 2 weeks so I don't have my trizepatide for 2 weeks, and I'm really hungry.
You have so many good restaurants there. Oh my god.
We do.
Yeah, I'm going out in 2 weeks with my wife. She's going to go on Watch What Happens Live because tonight. Well, Wednesday nights at 10 o'clock on E is Plastic Surgery Rewind. And Thursday nights, my wife's on Real Housewives of Orange County. And that starts tomorrow night, interestingly enough. Anyway.
Power couple.
Well, so we go to New York and she does the whole Bravo thing and I eat.
Oh, I love it.
That sounds great.
So
we should get, are you like a cold plunge? We should send him to Live Method.
Yes.
I love that.
Okay.
We have it's literally you will be the only person in there. He spent like $5 million making cold plunges, steam rooms, and saunas. It fits like there's nobody ever in there. We'll connect.
I really want to go. By the way, despite the fact that I'm into all of this stuff in exercise physiology and health and wellness, I've never done a cold plunge, and I know the benefits of cryo. I mean, but I just never done it.
We love it.
We're doing it.
Oh, I know.
We're gonna film it. We're doing it. It's happening.
Yeah.
It's already in the works.
I'd love to.
Okay, so our What Are You Nuts moment of the week are gripes with people, places, and things.
Yes.
Big and small, whatever's sticking in your craw. Ben and I will start. You have time to think, Dr.
Thank
Terry.
you.
There's no wrong answer. Go for it,
How do you
Ben.
think of this every week?
Who knows? We're just constantly annoyed.
Multiple. Yeah, we're constantly annoyed. Mine is, I've very famously said, if I have a bagel, Terry, right before I podcast, I can't remember anything.
Mm-hmm.
I don't know what it is. I might have a light gluten intolerance. Josh once brought me Russ and Daughters on the podcast. I couldn't think.
I'll tell you what it is.
Tell me.
Tell me what is a bagel? A bagel is a carb, and it's the most pure, easy to digest carb with, I won't bore you with glycemic index, but you know what glycemic index means? Too late, I'm going to bore you anyway.
Yeah.
The more easily it gets digested and turned into pure sugar and elevates your blood glucose, your blood sugar, the higher the glycemic index. Bagels are extraordinarily easy to break down and turn into pure sugar, and you get this inflammatory brain thing.
There you go. And that's why I take turmeric preventatively, and it helps me. But I'm in a house, we're in the Hamptons for the summer. My sister-in-law, Jackie, is a fantastic baker. Every morning, she has a fresh loaf of sourdough. I want you to know, Terry, right before I did back-to-back podcasts, I ate a thick sandwich, sourdough bread, turkey, mustard, lettuce, whatever. My brain is perfect.
Oh, that's a gluten thing, probably. Yeah.
So now my What Are You Nuts is to this bread, to these bagels. I'm going around buying this processed junk. It's making me think that I can't eat sandwiches during the day. All of a sudden, I have just like basic, nice, home-cooked bread. Josh, What are you, nuts?
Right.
Love that. What are you nuts? My what are you nuts is if you have a a Bible quote on your business card. Listen, you're not selling me. I don't care how many things you're trying to sell me with these. Listen, just come in. I need an exterminator, not a proverb. Okay? I'm glad you have a favorite saint, but can you just come in and do my drywall?
I would agree with that one too.
You know what
I would agree with that one as well. Yeah,
separation
what are you,
of
nuts?
church and state,
I
would
would
you?
agree with that one. Okay, I got
Nuts.
one. All right. So as a callback, I'm going right from here to the gym, right? So I'm very careful about, I go in the gym and I put my AirPods in and I listen. I have a personal moment. I listen to my music. I do the YouTube thing or whatever, and I work out. There are people who come in and A, will just talk on their phone as if we can't hear them,
Yes.
or B, with a speaker. One of these Bose speakers, and now I'm listening to their music, and newsflash, I don't like your music. And so personal space, personal audio space is not respected in the gym many times.
Terry, gym etiquette is the ultimate what are you nuts?
What are you nuts?
We've both been in steam rooms where people are on their speakerphone taking a call.
See what I mean? Just that. And then can I
And
add
I'm
one
just
more?
there trying to cruise.
Can.
One more.
Can.
One more. I am a major restaurant person. I live to go out to dinner, okay? Don't bring me into the restaurant, take me back to a table that is right next to the bus stand.
Yes.
Agreed.
I feel like
Nuts.
what do I work here?
Yeah.
It's right here. You're getting plates, you're getting silver. What are you, nuts? I'm eating here. Put me in a better part of the restaurant. Thank you.
See, you said, how can you come up with so many what are you nuts? It's because we're constantly agitated. We go through life seeing what's wrong.
Yes.
And then we fix it. That's what it is.
It's our
Terry.
biblical verses. We're one of your nuts of your biblical verses. Let's be honest.
Absolutely. Terry, it was an absolute pleasure. Please remind people again what to watch, where to watch it, where to follow you, and then we'll close up the show.
Okay. So, new show called Botch Presents Plastic Surgery Rewind, Wednesday nights, 10 o'clock on E. And then I don't really post on my Instagram, but I'm going to start doing these experiments and posting them. So you go to Dr. Dubrow and you can see it on YouTube and TikTok. And I'm going to let you know what works and what doesn't work in these really interesting, quick videos. They're going to answer a lot of questions that you've always wondered about, including like peptides.
Love it. Love
Yeah.
the peptide.
Including, should you eat protein before carb? Should you go for a walk after a meal? What does it really do to your blood glucose concentration? And so on and so forth. Lots of interesting things are about to come out. So that's my thing.
Love it. Well, folks, if this episode wasn't 5 stars, what are you, nuts? Listen to us wherever you get your podcasts. Watch us on YouTube. Share our clips, Instagram and TikTok, Mondays and Thursdays, folks. We will see you next time.
Thank you.
You guys are awesome.